button here. Okay, hi everybody. We have Cherry here with us today. She has been a patient of ours for the DRX 9000 spinal decompression. She's getting here to train the neck, and she was here because she has 4 discs on her neck that's bulging out, and that's the reason why she's here. So Cherry, can you tell us a little bit about your pain before you started treatment?
Well, when I first came in, my neck was always in some kind of pain unless I was lying down. I felt very stiff. I didn't want to move back and forth. Whenever I sat down or was in my car, it was very painful in my neck and my upper back.
Okay. Now, because of your neck, what is it that you cannot do? Or about your work, your house?
I basically didn't want to do anything that required me to bend over because it would put pressure on my neck. You know, if I'm reading a book, you know, I'd have to do this. You know, it was very sore, and I actually really limited my activities because I was afraid of making it worse.
What kind of activity that you really can't do before? Any specific ones?
Let's see. Well, you know, even when I would go for a walk, it would irritate this too. It would start to hurt.
Okay.
So, you know, I just really tried to limit, and it did hurt most of the time.
Most of the time.
But I was up and around.
I see.
Yeah.
Okay. Does the pain travel down to your hands at all? Or arms?
I haven't noticed anything specific.
Okay.
Yeah.
Okay. I see. Now, so how many sessions that you've done on the DRX until you're actually feeling better, feeling improvement?
I actually noticed after the first one.
First one? What kind of improvement do you feel after the
I
first
noticed
session?
that my neck was not as stiff, that my posture was better. It was easier for me to correct my posture. I tend to want to stick my neck out. And it was much easier to maintain a better posture. Before, it was constantly having to check myself, correct my posture. Yeah.
I see. Okay, so after how many sessions? Let's say right now you are doing about 15 sessions, something like that?
So.
Okay, how are you feeling now?
A lot better.
Before?
A lot better, yeah. I have a lot more flexibility in my neck. The pain is, you know, minimal to, you know, annoying, but it's not chronic. There's times when I don't have pain. Most of the time I don't have any pain. If I overdo it, you know, I'll get some pain in my neck. But it's much milder. You can even drive the car used to be the worst thing, and even driving a car now is much better.
Okay.
Significantly better.
Before you come into us for treatment, did you visit any other doctor or physician?
Yeah, I had been to an orthopedic doctor. He did the MRI on my neck and sent me to physical therapy, and that relieved me of the pain. The only problem was that, you know, even though if I kept the exercises up at home, there were still things they did for me that I couldn't do for myself, like manipulation, you know, of my neck and so on. And so I was constantly asking my husband to kind of like pull on my neck to relieve some of the symptoms.
Right.
And I also was living in this like anticipation it's going to get worse. Eventually, just by wear and tear, I knew it'd have to get worse in 20 years, you know, 30 years. So I felt really worried about it. I was always aware of it. So, you know, when I found out about this, I thought, wow, this is actually going to decrease the actual problem, not just the symptom, not just the pain, but actually give me back some of that, you know, original state that I had before.
Good.
So, yeah.
Wonderful.
Yeah.
So when you knew about the price you had to pay for the session, what was your reaction, and why do you decide that this is for you?
Well, I was disappointed that insurance didn't pay for it because I'll pay for surgery, and this is less expensive than surgery and less invasive, and all that. But I figured, you know, this is my my life. It's my, I can't think of the word, the quality of my life.
Okay.
And I felt like I had to restrict myself to so much. Just didn't want to bend over, didn't want to do so much, and constantly worried about it. And I thought, well, this is a big difference in my life. I don't have to worry about hurting my neck so much over little things, making it worse, eventually having to have surgery. You know, this will give me, you know, a bigger time frame. Maybe in, who knows, in 30 years when I'm, you know, 70 or something, maybe I need something else, but at least I don't have to worry about it as much now, and a lot less pain.
That's good. That's awesome.
Yeah. And I forgot to mention the numbness that I would get in my face and the pains in my face. Those
Right.
have greatly reduced too.
Awesome.
Usually it's been gone unless I do something to irritate my neck, and it'll come back a little bit, but not like before. And then after the treatment, it'll go away.
See,
So,
good.
yeah.
I think, did you ever mention about your hands?
Yeah, the numbness in my hand, because of the operation and all that, I can't really tell if it's lessened or not. It's a little hard to tell because it's just that, it was already numb. It might be a little bit less, but it's hard for me to say. I've been focused on my neck.
Of course.
And, yeah.
Awesome. Okay, I think that's all we have.
Okay.
Thank you, Cherry.
Sure, you're
Appreciate
welcome.
it. Thank you much.
Sure.